Your health data is being bought and sold right now, and you probably don't even know it's happening. AI companies are paying millions for intimate information about where you exercise, what medications you take, which hospitals you visit, even your mental health appointments. They're using all of this data to train their algorithms, improve their models, and build better AI, all without asking your permission or paying you a single cent. But here's the thing that makes this so wild. It's completely legal today. It happens silently, buried in secretive data broker markets that most people never even hear about. Big tech buys and sells this information like it's just another commodity, like wheat or oil. So yesterday, Elizabeth Warren and a broad coalition of lawmakers decided to change the game completely. They introduced the Health Location Data Protection Act, brand new legislation designed to ban AI companies from buying, selling, or using your health and location data without explicit written consent. This isn't just about privacy anymore. It's about who controls the intimate details of your life and whether massive corporations should be allowed to profit from your medical records. So what's really happening with your data today? And what does this new law actually mean for you and your family? That's what we are diving into right now. So how did we get here? How did it become normal for AI companies to buy and sell your health data in the first place? Well, it starts with data brokers. These are companies whose sole job is to collect, package, and sell personal information. They operate almost entirely in the shadows. They buy records from hospitals, pharmacies, fitness apps, insurance companies, anywhere that touches your health or location. Then they aggregate it all together, your entire digital health footprint, and sell it to the highest bidder. And those bidders increasingly are AI companies. Why? Because health data is like gold for training AI models. It's rich, detailed, and deeply personal. It tells an algorithm not just what you do, but who you are. There's a massive market for this. Data brokers are making millions. AI companies are buying millions of records. And your data broker consent, well, buried in some terms of service you definitely didn't read, you likely already gave it away. But here's what's changed. We are talking about massive scale now. We're not talking hundreds or thousands of records. We are talking tens of millions of Americans' intimate health information flowing into AI systems. And that's exactly why lawmakers are now saying enough is enough. So how does this actually work in practice? Let's trace a real data journey. Imagine you use a fitness app like MyFitnessPal and you log your workouts. That app is connected to data brokers. The terms you clicked through when you signed up allowed it. That data broker now has your exercise history, your location history, your heart rate data. Meanwhile, you visit your doctor about anxiety. That clinic sells your anonymized records to another data broker. Separately, you buy allergy medicine at CVS. The pharmacy shares that data too. Now a data broker has aggregated all three data streams and linked them together with your other digital footprints. They create a profile, a person with anxiety who exercises regularly in downtown Seattle and buys allergy medication. That profile is incredibly valuable. An AI company might pay thousands of dollars for access to thousands of profiles like yours. They use it to train models that predict health outcomes or to sell targeted advertising to pharmaceutical companies. Everything is supposedly anonymized, meaning your name is removed, but your data is still deeply identifiable if you know what to look for. The scary part, this is all currently completely legal. Nobody asked you, you didn't consent, it just happens. So why should you care? Well, think about what AI companies could do with this kind of data. A health insurance company could use AI trained on your medical history to deny you coverage or raise your premiums. A loan company could refuse you a mortgage because the data shows you have a chronic illness. An employer could avoid hiring you based on an algorithm that predicts your health care costs. A bad actor could even de-anonymize this data and sell your actual name linked to your diagnosis. This isn't hypothetical. We've already seen insurance companies price discriminate based on health data. We've seen lenders use AI to deny credit to protected groups. And researchers have proven repeatedly that supposedly anonymized health data can be re-identified in seconds with the right technique. But there's an even darker possibility: predictive policing. An AI trained on health data could flag certain individuals as statistical risks before they've done anything wrong. Imagine being prejudged by an algorithm trained on your medication history. The worst part is, you'd never even know it was happening. The decisions would be made by a black box, justified by a statistical model, and you'd have no way to appeal or even understand why you were denied. That's the future we are heading toward if this bill doesn't pass. So is the United States behind on this? Actually, no, we are catching up. Europe has been way ahead. The European Union's General Data Protection Regulation, the GDPR, passed way back in 2018, and it's incredibly strict about health data. It requires explicit consent before any company can process your medical information. No burying it in terms of service. No data brokers silently harvesting your records. Health data is treated like a protected category, same level of protection as race or political beliefs. And you know what? The world didn't end. Europe's tech industry still thrives. California tried to do something similar with the California Consumer Privacy Act, but it had big loopholes. Health data wasn't protected the same way. That's what this new bill tries to fix. The Health Location Data Protection Act would basically bring the United States closer to European-level protection. It says AI companies can't buy your health or location data without explicit, informed consent. No exceptions, no data broker loopholes, no buried terms of service. But here's where the comparison gets interesting. Even Europe's GDPR has been imperfect in enforcement. Big tech companies have faced fines, but they keep doing it anyway. Because the fines are small compared to profits. So the real question isn't whether a law exists, it's whether it'll actually be enforced. So what happens if this bill actually passes? Well, first, AI companies would have to completely change how they operate. No more silent data acquisition. No more exploiting terms of service loopholes. They'd need explicit written consent from you before they can buy or use your health or location data. That's a massive change, and it could reshape AI development itself. A lot of modern AI has been trained on datasets that were acquired in morally gray ways, data that was technically legal but deeply ethically questionable. If companies can't access health data without permission, they'll have to find other ways to build their models. Some will pivot to synthetic data or publicly available datasets. Some will build partnerships with hospitals and clinics where people actually consent. The business model changes. But here's the flip side. What if this bill doesn't pass? Well, the data harvesting continues. AI companies keep training better models on your intimate health information without your knowledge or consent. The disparities get worse. Vulnerable populations get targeted for predatory algorithms, and eventually, some catastrophic breach exposes millions of Americans' health records tied to their identities. You'll see it in the headlines. There'll be a week of outrage, and then nothing changes. That's our trajectory without this bill. So the question isn't really about innovation. It's about whether we want to live in a society where your most intimate information is a commodity for sale. So what can you actually do about this right now? Well, first, your data's probably already out there, but you can start protecting it today. 1. If you use fitness apps, medical apps, or health trackers, go into the privacy settings and opt out of data sharing whenever possible. It won't undo the past, but it'll stop new harvesting. 2. Use a VPN and privacy-focused browsers on your phone. Don't let your location data follow you everywhere. 3. Request your data. Most states have privacy laws that let you request what companies have on file about you. California's law is one of the strongest. Ask for it, see what's there, and file a deletion request. It takes time, but it works. 4. Contact your representative and tell them to support this bill. The Health Location Data Protection Act needs votes. It needs public pressure. It needs people like you saying this matters. Don't assume someone else will do it. They won't. 5. Stay informed. Subscribe to channels like this one, read the fine print on apps you use, and understand the data economy you're trapped in. Knowledge is power. And finally, support privacy-focused alternatives. Use apps that explicitly don't sell your data. Pay for services that treat privacy as a feature, not an afterthought. Vote with your wallet and your voice. This battle is just starting. Here's what this all means. Your health data is one of the most valuable assets about you, and right now, it's being sold like used cars on a lot you didn't even know existed. But there's a real chance to change that, and it's happening right now. The Health Location Data Protection Act won't solve everything. There are already loopholes in how it's written, and enforcement will be a battle. But it's the first serious federal legislation to draw a line in the sand and say AI companies can't exploit your medical privacy anymore. This bill won't pass itself. It needs congressional support. It needs public pressure. It needs millions of people understanding that this isn't a niche privacy issue. It's about whether you have fundamental rights over your own body and your own data. So here's what's next. Watch this space. This bill is going to the Senate this week. If it passes, it'll be one of the most important privacy victories in a decade. If it fails, the harvesting continues and we all lose. The stakes could not be higher. Subscribe for updates as this story develops. We'll be tracking every vote, every amendment, and every attempt to water this down. Your privacy isn't a feature to negotiate away. It's a fundamental right. And right now, the people in power need to hear you say that matters. Follow for daily AI news and stay in the loop. This is just the beginning.